So let me start again. Good morning, good afternoon, wherever you are. I'm Indranil Ghosh from the Swiss Embassy, and welcome to this second webinar of a series on international digital governance as seen from Geneva. We had a fascinating discussion a week ago on international digital governance generally, and today we will focus on governance for digital health. I will hand the mic over now to Ambassador Dr. Ralph Heckner, the Ambassador of Switzerland to India, for his opening remarks. Ambassador, to you, please.
Thank you, Indranil. It's great to be back discussing digital global governance today with a focus on health. I'm very happy to be here with dear friends like Mandip Gill, one of the finest Indian diplomats, and it's great to have you here. I'm happy to be with Joint Secretary Agarwal from the Ministry of Health, Caroline Perrin from the University of Geneva, and Louis Gagasnap from the World Health Organization. You will know all much more than I do when it comes to digital health, digital global governance and health. And it will be Professor Reddy who is in charge of moderating today's panel. So as an ambassador of Switzerland to India, let me give you quickly my bilateral perspective on today's event and why today's event is important in my assessment for our bilateral relations. If I have only a look at India, yesterday the Prime Minister of India launched an important digital health mission. It's called Ayushman Bharat Digital Mission. And with that, the Indian government is launching a health idea, a digital health idea for the Indian citizens in order to be able to create an Indian digital health stack on which other businesses can be built upon. And this is one example when it comes to India moving forward very strategically in the digital world and being on top of the digital wave. There's another example that I would like to give you, and that is based on my experience here, first year experience as ambassador to India, having a look at COVID and how the Indian government and the Indian administrations have worked with digital solution in order to fight the pandemic. I was impressed to see that, for example, states like New Delhi were working digitally in order to give the citizens in Delhi access to information where ICU beds were available, in which hospital they were available. And if you have a look at the vaccination drive of the Indian government, as of today, we have 870 million vaccinations that were uploaded on a digital platform that is called CoWIN. And 704 million persons have registered on CoWIN for the vaccination drive. One of them is me. So this is an incredible and remarkable achievement. Just the numbers are mind-boggling, especially for Swiss people. 870 million vaccines that were digitally now registered and physically administered. Now, having a look at Switzerland, there's a Swiss health policy and strategy for 2020-2030. That policy is very much looking into digitalization as an opportunity for us to be able to harness the gains of digitalization for our health system. The Federal Office of Health is looking into the creation of an electronic patient record, something that is going along the lines of what Prime Minister Modi launched yesterday that shows us also that India is an interesting partner for us in order to learn and to be on top of the digital wave together. Switzerland, when it comes to our foreign policy and foreign policy regarding health, is also supporting something that is of importance, and that is the global health data governance framework. We always feel that it is important that what we do at a national level is based on an international foundation. And this will be also today's topic, global governance, digital global governance and health. Now, having had a look at India and having had a quick look when it comes to Switzerland and digitalization in health, let's have a look at what we have here in India. Switzerland has quite a broad network in India that is very much in line with what we are discussing today. There is a Science Consulate in Bangalore, and the Science Consulate in Bangalore, called SwissNext, is very much in facilitating the entry of Swiss startups, among them also startups from Switzerland in the health tech sector. The Swiss Business Hub in Mumbai is actively working on connecting businesses from Switzerland in the healthcare, medtech, pharma, sector, and 18 Swiss companies are present in India, and they are creating 12,000 jobs. That shows you also how important the Swiss health care pharma presence is in India. And one of the big pharma businesses from Basel has its digital innovation hub in India, in Hyderabad. So we do not only have Swiss startups that are working in the health sector, we also have quite a number of important Swiss businesses, 18 that are physically present here. And the same applies to Indian businesses present in Switzerland. All in all, we have about 140 Indian businesses present in Switzerland, and 2/3 of them are in the IT sector, are in the life science and medtech space. There as well, there is quite some, there's a big foundation in India, a strong foundation in India and in Switzerland to work on. And what can be built on such a foundation? I would just launch 3 ideas. First and foremost, I think, as I said, we can learn from India and we can learn together when it comes to digitalization and health. There was a first Indo-Swiss health dialogue held in April. I'm very much in favor of institutionalizing such a health dialogue. My second point would be that we concretely continue to promote collaboration between the health tech startups. And we are well positioned because SwissNext in Bangalore and the Swiss Business Hub in Mumbai have been doing that for years. I think we can do that more strategically together. And last but not least, there is a place where we can work together when it comes to global digital governance and health, and that is Geneva. And that is the reason why we have speakers from Geneva, the International Geneva, that are with us and giving us the Geneva perspective on global health and governance. And with that, I'm very much looking forward to learn from the colleagues on the panel today and to see how we can strengthen our bilateral relations by working together on digital global governance and health. And with that, back to you, Indranil. You seem to be our master of ceremony.
Yes, it seems. Thank you, Ambassador. Before we get on, continue with the program, some comments or things for our participants. Please use the chat box for any questions you may have to any of our panelists. And if you wish, please tell us whom you'd like to address the question to. We have a slight change in program. Professor Balram Bhargav unfortunately could not be with us. So he's been replaced by Dr. Harpreet Singh from the Indian Council of Medical Research. And as Mr. Love Agarwal said, he will have to leave. So after his presentation. So without much ado, let's get on to our keynote speaker, setting the scene, leveraging global research in digital health as seen from Geneva. And our speaker is Dr. Amandeep Gill, the CEO and Project Director of the Digital Health and AI Research Collaborative, IDARE, based out of the Graduate Institute in Geneva. Dr. Gill, over to you.
Thank you, Indranil, and thank you, Ambassador Hackner, dear Ralph, for the warm words and for this opportunity. You spoke a key word when you mentioned learning. So this is about shared learning bilaterally and multilaterally. And I want to bring a perspective that combines the research side, the science side, and the multilateral diplomacy side, using this framework of shared learning governance. Geneva, where I'm currently based, has led the way in many key areas, humanitarian action. So that whole field of knowledge was put together here. And it's a distributed field of knowledge. The humanitarian actors are present all over the world. They are governed well, they are impactful. So it's something that's enduring, that lasts. Likewise, if you think about international education, the entire IB program, the international education movement was seeded here. And you've had alumni like Mrs. Indira Gandhi, Al Gore, who've come out of that particular movement of building international-minded citizens. And closer to science, you have the example of CERN, this post-Second World War experiment in pooling resources to do what no single country, no single institution could do by itself, study the mysteries of nature, advance fundamental science, and then come out with global public goods such as the World Wide Web or medical scanning techniques that have been shared freely with the rest of the world. So this is the heritage with which we are starting off. So what about the health domain? And Louise is here. So Geneva hosts the most significant actor on global health, which is the World Health Organization. And there's an entire ecosystem of other organizations. IDARE is a relative new entrant to that, but there are fairly established organizations such as the Global Fund, Gavi, many other actors. And when you bring in digital, you have the ITU. So there's an entire Geneva ecosystem that is key to advancing digital health. Now, you could say that maybe more of the same would get us to these kinds of outcomes of universal health coverage, quality health care for everyone that we are looking at. But perhaps not. When you bring two very different, very complex fields, namely digital and health together, there would be many surprises. Some not so pleasant, but hopefully many that are pleasant and that are disruptive in a good kind of a way. So this is the space in which IDARE is shaping itself as a distributed CERN. We are proud not only about our presence in neutral, independent, impactful Geneva, but also in the hubs in India, in Singapore, in Kenya, in Chile, in Tunisia, and this network is growing. And it's essentially about building a community around science, around digital health, to harness the digital transformation responsibly and inclusively for the universal health agenda. We are inspired by the call for data and AI commons and new models of collaboration to build global public goods that came out of the UN Secretary General's high-level panel on digital cooperation. And we have a particular focus on connecting and convening young researchers, especially from emerging geographies of innovation, to work on global health challenges, or what we call pathfinders in the IDARE lexicon. So why does this distributed CERN for digital health and AI in health matter? In my own experience, the deepest inequities are about knowledge making. So conversely, if we can lower barriers to knowledge construction in any domain, level the playing field, so to speak, we can make the benefits more widely available. This is what is the most exciting about idea. I would conclude by just mentioning a few words on governance. So, just as science is a great leveler, knowledge is a great leveler. In diplomacy, as young diplomats, you have this idealistic belief that multilateralism is a great leveler. Every country, rich or poor, big or small, has a voice, a vote, and multilateral institutions work to everyone's advantage. I still keep the faith, but my optimism is now tempered by realism. So we have to work hard every day to make multilateralism count and make collaboration work across borders. And the key is bringing these two aspects of science, governance, and digital governance together in the context of concrete global outputs, in this case, quality health coverage for everyone. That reminds us that multilateralism exists for a global purpose, and digital technologies are not an escape from our analog world, but they are a means to addressing its challenges. So I'll stop here, and I am looking forward to learning from this most exciting panel that is to follow. Thank you.
Thank you, Dr. Gill. And now hand over to Professor Srinath Reddy, the President of the Public Health Foundation of India, to moderate the conversation panel that follows now. Professor Reddy, over to you. We cannot hear you, Professor Reddy.
Thank you very much. We have a very distinguished panel with Mr. Agarwal from the Ministry of Health and Family Welfare, Government of India, Louis Axel, who is from the Department of Digital in the World Health Organization, Dr. Caroline Perrin, who is from Geneva Hub for Global Digital Health, and from the Geneva University Hospitals. Particularly, she's looking after the Division of e-health and telemedicine at the Geneva Global Hub. We have Ms. Erika Placella, who is the Deputy Head of Division of Global Program for Health in the Swiss Agency for Development and Cooperation. And we have Dr. Harpreet Singh from the Indian Council of Medical Research. Since Mr. Lav Agarwal has a pressing engagement elsewhere in the ministry, may I request Mr. Agarwal to make his remarks. I believe he has a PowerPoint presentation. So if the Swiss Embassy Secretariat can enable slide sharing for Mr. Agarwal, then it will be very helpful that we can invite him to make the presentation.
Just trying to get that up. Give us a second.
Thank you, Professor Srinath Reddy Saab, and our Excellency Ambassador from Switzerland to India, Dr. Amandeep Gill sir, and all my distinguished panelists. It's a pleasure to be part of this discussion today. At the outset, let me express my regret that I have put in this request that I may like to leave early because of a ongoing engagement with Honorable Minister here. There is a small presentation I would like to run through, primarily to take on from what Ambassador sir did mention about few of the IT initiatives which are happening in India to begin with, and coupled with that, wherein India is trying to focus on the digital health governance at the national as well as the international level. We'd just like to sort of give a snapshot of that so that this whole conversation about view from Geneva, we can also put in that viewpoint and then parallelly learn also from other panelists who may be also highlighting some of the issues at the end. So I see that we are not able to get the presentation online. If there is a technical challenge, if I can be given the share rights, I can do that also.
We're just
trying to
getting
do
the
that,
presentation up. Just give us a second.
Sure.
while they're trying to do that, may I congratulate Mr. Lavagarwal on the launch of the Atmanirbhar digital mission by the Prime Minister yesterday. I know that Mr. Agarwal has been one of the key figures in shaping the digital health program for India.
No, thank you. I think it has been efforts of advocacy at all levels, and I'm sure we have been getting all the support from all colleagues, including PHFI, which has actually been playing a major role in advocacy on use of technology as far as the health sector is concerned. I think so. I'm hoping that the presentation will come soon.
Okay, it's coming.
Perfect. So I think.
Can you see it?
Yeah, we are able to see that. Thank you, please.
Yeah.
So
Perfect.
can we go to the next slide, please? So what I would like to highlight, what is the vision which India has kept for itself in terms of digital health agenda? So idea and focus here is that we need to create an ecosystem which can support universal health coverage. And what are the major components of that ecosystem on digital health we want to build? So we are looking for an efficient healthcare system, which is accessible and inclusive, which is also affordable to people, parallelly focusing on open, interoperable, standard-based digital systems, and with equally important focus on the security, confidentiality, and privacy of the health-related information. With this as the overall vision, which is put across in the National Health Policy of Government of India, we plan to approach in terms of creating electronic health record for 1.39 billion people of this country through a pan-Indian exchange. The focus is also on that can we create a pan-Indian telemedicine network as a output-oriented task. Parallelly also, can we create a surveillance network and a mechanism wherein all the ongoing programs by Government of India can be monitored. Equally important, we realize that IT can enable us in terms of ensuring capacity building and training, cutting across remote and far corners across the country on a real-time basis. So we would like to utilize IT also for capacity building and regularly focus on governance and information dissemination. This being our ecosystem approach. Next slide, please. Can we go? Yeah. So what had happened is we realized that we had actually been historically in the last almost a decade working on multiple activities, which included planning and monitoring, hospital information system, public health solution, whether it is monitoring TB, whether it is mother and child health, whether it is telemedicine. Parallelly, we were also working on supply chain management issues in terms of blood bank management, vaccine movement, or drug and vaccine distribution management. We also had been utilizing a lot of IT tools for data-driven insights into COVID management or emergency management. And we had some solutions which are primarily focused on patient feedback system, like a patient public interface, or wherein people can take online registration of seeing a doctor in a particular government hospital itself. But while all these initiatives are going on, we also realized there are certain challenges. The challenges are in the sense that we are not able to take the best advantage what digital technologies are supposed to offer to us, because these all these IT solutions were standalone and fragmented. There was a lot of data redundancy. We were collecting similar demographic data across different health systems, but they were not still talking to each other. There was lack of interoperability, so the data was primarily remaining in silos, and we were not adopting standards which could have facilitated formation of interoperability across the health spectrum. So with that in a situation in hand, that is where comes a major intervention on behalf of Government of India. Next slide, please. And this was the major intervention primarily in terms of focusing on a national digital health blueprint. And this blueprint was done in the year 2018, which talked about creating federated architecture, focusing on open standards. It created architectural principles and provided for 5-layered system of these building blocks. It was supported by a unique health identifier. Parallelly, equally important focus was on privacy and consent management and national portability. And it talked about providing digital health services across all medium, including web, mobile, through call center, etc., so that across the spectrum services can be seamlessly made available. With that in a framework in mind, next slide, please. we actually in the digital health blueprint also proposed a mission approach in terms of implementation. And as has been highlighted, so on 15th of August last year, Honorable Prime Minister first launched National Digital Health Mission, and it was an overall all-encompassing approach towards digital health based on those architectural principles which had been defined into the National Digital Health Blueprint. It talks about creation of unique health ID, it talked about creation of a doctor's registry, it also talked about creation of a health facilities registry. And I'm happy to highlight that based on the phase 1 implementation, which was primarily in 6 union territories, learning from that experience on 27th of September itself, Honorable Prime Minister announced the national rollout of National Digital Health Mission, recreation that Ayushman Bharat Digital Mission, so as to focus on implementation of digital health technology. Next slide. And when we were talking about all this framework, I would also like to specifically highlight that data-driven insights became one of our major reasons in this country in terms of overall our COVID-19 management. And if you see all the core approaches wherein we were working with respect to COVID-19 management, whether it is surveillance and contact tracing, it was the Arogya Setu application, which I would like to specifically highlight that it is the most downloaded application in the world with more than 205 million downloads. Similarly, when it comes to logistics management, we were utilizing COVID-19 India portal. When it came to laboratory management, it was both RT-PCR app at the field level and CV analytics portal at the ICMR level, which was monitoring all the samples collected across the country and which were found positive. Even facility app was utilized for monitoring the hospital preparedness, and eSanjeevani online OPD was supporting us in terms of ensuring that when people are in lockdown, in that environment, how do they get access to the medical services? Our website for risk communication, IGOT training platform for capacity building, and CoWIN, which respected ambassador talked about for ensuring that there is effective vaccine distribution across the country, and 870 million doses which had been given across the country are monitored with respect to this particular application. Next slide. Parallelly, I've talked about COVID-19 portal. So this became our real-time web-based platform to capture, analyze, and understand and keep track of COVID situation across the country on a daily basis. So whether it is patient analysis, what is the case positivity across the country, whether it is identification of containment zone, whether it is to see whether the infrastructure available is sufficient, when it will become deficient, doing a projection on that, and based on that, do a advanced planning, parallelly identifying surveillance parameters like testing trajectory, comorbidity analysis, and including multiple dashboard reports, analytics report. These became some of our approaches in terms of identifying where cases or case positivity or infrastructure might be under strain, and where a specific action has to be done at the national level in consonance with the state and the district administration. So this became one of our approach. Digital health supported us in terms of managing the overall case management across the country. Next slide, please. Similarly, as we talked about surveillance, so we had an integrated disease surveillance ongoing program, which was reformed, and we reformed it through again, IHIP portal, which is Integrated Health Information Platform, wherein I would like to specifically highlight 33 diseases, epidemic prone diseases are monitored, name-based, GIS enabled, and more than 200,000 government facilities across the countries are already integrated through this pattern. And if you see in the map sideways, you can actually generate heat map where a particular disease is being seen in large numbers, so as to identify pockets and take timely action in terms of management of these infectious diseases also. Next slide. We had put a bigger focus parallelly on telemedicine, and I'm happy to highlight to all our colleagues who are present here that this has become the most used application in the world in terms of 12.4 million consultations which have been done. We are doing on an average around 80,000 consultations per day through 2,300 dedicated hubs, 27,000 health and wellness centers across the country do doctor-to-doctor consultation through this pattern, and there are 447 OPD clinics which are running, which are providing direct citizen interface services through this particular telemedicine application. And to ensure that this application actually work at field, we had actually in the last 1 year undertaken extensive training across the country, including 80,000 people plus who were trained in terms of using this application. And it is also a positive note, I would like to highlight that Honorable President of the country actually gave award under platinum category for innovation in pandemic, because it was such a big support in pandemic in terms of managing home isolation people, in terms of managing people who were in the jails or even the old age hostels where they were there, so that while they are in a bubble, they could still be provided health provisioning through this particular telemedicine application. Next slide. I would also like to, in a short way, highlight the vaccine delivery management system. Can we click again, please, twice? So this is the vaccine COVID platform which was done. It is an enterprise level software made by the country, and as the Amandeep sir talked about, that is also being provided as a global good to the world at large today, wherein be it session planning, beneficiary registration, beneficiary vaccination, beneficiary acknowledgement, linking it with a unique health ID and a QR code based certificate is also being generated for first dose as well as the second dose through this particular application. We were just part of the Indo-US Health Dialogue. I'm coming from there. I'm very happy to highlight, when I was discussing with my colleagues from US, they said that the certificate in US is issued by either a private provider or even a particular state. They do not even have a national level COVID vaccine certificate, whereas we realized at the initial stage itself that a QR code based certificate can facilitate travel, and also it is required parallelly to monitor someone who has been given the first dose also needs to be monitored, that at right time he has to be given second dose, and as well as AFI reporting also becomes one of the major component of this particular IT application. Next slide. So this is again just that it is a scalable software, and as has been amply highlighted that it takes care of millions and millions of people, and it is made enough to manage billions of people which this country has. Next slide. So this is the dashboard, and I'm also happy to highlight that I was showing this dashboard to our counterparts, colleague from US, and in front of us online, when people anywhere in the country in more than 30,000 locations, they were getting their vaccine, the real-time online data updation was taking place, which gives us a lot of confidence that in terms of overall monitoring how digital health can support initiative across the country. Next slide. Even not only these initiatives which are happening, particularly at the national level, they are being collated and coordinated now through a national digital health mission approach, through the Ayushman Bharat digital mission approach. We are also aware of the fact that when it comes to digital health, there is a need for creating a governance structure. There is a need to focus on bringing multilateralism into it, so that we can actually create an overall framework for world at large. And the silos which exist within the countries also exist between the countries. So can we sort of work towards ensuring that those silos to an extent can be lessened? And it was India which moved a resolution on digital health in May 2008 in World Health Assembly to sort of prioritize the agenda. India is also currently the chair of Global Digital Health Partnership, which is the world's biggest intergovernmental partnership with 33 countries as members, including Switzerland, I would like to specifically highlight, and 2 international organizations, WHO, OECD, and one NGO, the first NGO which joined is IDARE, and I would like to thank them for being proactive in terms of driving the agenda at the international level. And also the fact that we came up with the Delhi Declaration on Digital Health for Sustainable Development. India is also driving the agenda as chair of BRICS, and we recently hosted on September 2nd and 3rd the BRICS Digital Health Summit. And within Commonwealth also we are trying to drive on the agenda, and there's a Commonwealth technical working group for strengthening digital health which has been recently established. So I would like to end by highlighting specifically the point that we are working within India. We are also trying to create an environment across the world so that we can collectively take this agenda forward. We personally feel at national level, at country level, we feel that this is a low-hanging fruit, and this is going to be a game-changing event when it comes to healthcare delivery across the country and world. Thank you very much.
Thank you very much, Dr. Agarwal. That's been an excellent overview of India's many efforts in utilizing digital health to great advantage, both for efficiency and equity in health systems. I understand that you have a different engagements, so thank you very much.
So thanks a lot, please. Thank you, everyone. Thank you.
Now I come to the other panelists for their remarks. I have 6 panelists, so I would like to try and engage them with some questions which particularly address their areas of interest and invite relatively short and crisp responses so that we can rotate the conversation. Dr. Perrin, how has the international cooperation narrative in digital health been framed in the global COVID response? Has digital health indeed enabled an efficient global coordination in the response?
Sorry, could you repeat the question? I didn't hear it very well.
How has international cooperation enabled a concerted response to the COVID pandemic at the global level? In terms of international cooperation.
Sorry?
In terms of international cooperation being fostered through digital health.
International cooperation was very important in the COVID-19 pandemic to being able to trace data across borders, to being able to learn from making informed decisions, learning from what is happening in different regions. I'm just a bit surprised. I was thinking that we are all supposed to give a statement, but I'm happy to answer questions. So I'm very sorry.
No, you can go ahead and give a statement as well. These are some of the questions that were prepared by the embassy, and I thought these are some of the things that we might like to explore, but please give whatever your reflections are.
I would just like to really make a 3-minute statement on emphasizing why governance is so important to digital health. And first, I would like to thank the organizers for giving us the opportunity to participate, and to the other speakers for sharing their insights. Because we only have a very limited amount of time available, I would like to quickly illustrate our insights by making use of the parable of the blind man and an elephant. So for those of you who are not familiar with it, the parable of the blind man and an elephant is a story of a group of blind men who have never come across an elephant before, and who learn and imagine what the elephant is like by touching it. So each blind man feels a different part of the elephant's body, which can be the side or the tusk, and after they describe it. But based on their limited experience, their description is surprisingly not the same as the description of the other blind man. And we think what this parable nicely illustrates is that how do we govern digital health if we only see parts and do not have the full picture? And this really emphasizes one of the main challenges we are facing in digital health, which is fragmentation. And it's also a challenge that we have seen in international cooperation in getting the data across the borders that we need. There's also lack of best practices or best practices that are based on a limited amount of experience. What the COVID pandemic has also shown us is that even though these barriers exist, the pandemic really generated an unprecedented growth in digital health solutions. And we are in an exciting momentum, and we should use this momentum to further build on and enhance the global digital health ecosystem. But at the same time, while using this momentum to progress, how can we make sure we don't further fragment? One crucial component is strengthening governance in international cooperation. Governance really has a strong impact on all the components of the digital health ecosystem. It's an enabler for interoperability, sustainability, and ultimately an impact for transformation of health systems. But as we have seen in the parable, we need to understand the full picture of the elephant by documenting and connecting what each blind man sees. And we also need to make sure that these blind men talk to each other. For us, in this parable, the blind man represents different stakeholders from the ecosystem as normative organizations, governments, shapers, implementers, but also the private sector. And these blind men need to talk to each other and to collaborate. And we need to use these insights from the full picture and from collaborations to feed into and inform governance processes. And that's what we are envisioning with the Geneva Hub for Global Digital Health, to really systematically connect people, projects, and knowledge in digital health to extract actionable insights that can guide impactful implementations and inform governance processes. Yes, it was just the few insights we wanted to share from our perspective.
Thank you. Thank you very much. Let me now request the WHO, which has the global imprimatur and is one of the most respected agencies which connects all the countries, to provide their perspectives. How can we integrate all healthcare players, service providers, pharma majors, patients, insurance providers into a digital health governance framework? And how is WHO going about scaling digital and other innovations in countries, particularly with the idea of how is it going to customize to the specific needs of different countries? May I request Ms. Louis Agersnap to reflect the views of the WHO?
Professor Dr. Reddy, and also a big thanks to the Ambassador Hegner for inviting me to this panel. I'm delighted to be here among such distinguished speakers. If I may first provide a small statement about where we are with digital health and WHO's recently formed and member states endorsed strategy on digital health. I will do that first, and then I can turn to your questions. Would that be acceptable, Dr. Reddy?
Sure, please.
All right.
Please go ahead.
So, well, first of all, as I think has already been established by Ms. Perrin, digital technologies hold enormous potential and will continue to evolve this huge potential for transforming the health of entire populations going forward. We've also seen in the fight against COVID-19 how digital technologies are helping to keep people safe, healthy, connected. For example, we've seen digital health technologies being used to screen populations, track infections, monitor the supply of health resources. And in the years to come, digital technologies will play an increasingly important role. And I congratulate Joint Secretary Agarwal for these amazing examples from India and how India is organizing and leveraging digital health for public health and well-being. At the same time, the technological challenges created in the wake of COVID-19 have been tremendous. Without a solid policy, well-matched collaborations, and the right vision, technologies can be rendered powerless, lose focus, or worse, be misused or become dangerous. WHO has made harnessing the power of digital technologies to improve health and well-being a key priority. We've established this department that I'm currently leading of digital health and innovation to support countries to prioritize, integrate, and regulate digital technologies. Our global strategy on digital health, sponsored by the Government of India and approved by the World Health Assembly, calls for close collaboration with international partners and other stakeholders, including the private sector, to prioritize, integrate, and regulate digital technologies. Collaborations such as the ones we have with the Swiss Development Corporation, University of Geneva, the Graduate Institute, and the collaboration we are now forming and formalizing with IDARE, and thanks to Dr. Jill for his wonderful collaboration in that regard. These are collaborations on implementation science and knowledge sharing that are critical to facilitate informed investments into digital health and the success of the global strategy. Just briefly, the strategy is focused around 4 strategic objectives and which will be operationalized. The first one is to promote global collaboration and advance the transfer of knowledge on digital health. The second objective is about advancing implementation of national digital health strategies, and India is really walking the talk here. The third one is particularly important for today's discussion. It's about strengthening governance for digital health at the global, regional, and country level. And lastly, the fourth objective is about advocating people-centered health systems that are enabled by digital health. Within the scope of the third objective, which is about governance, strengthening digital health governance, we're supporting our member states in developing guidance to support countries to facilitate the development of policies, investment plans, and governance mechanisms. These include recommendation around national data governance, advice on investing in evidence-based digital solutions and systems, and recommended digitized health and data aligned with WHO guidelines and interoperability standards. And then to your second question, Dr. Reddy, additionally, WHO's Innovation Hub, which I'm also leading, and which is part of the Digital Health and Innovation Department, is also focusing on leveraging and scaling innovations in health, be it digital solutions, social innovation, and technological innovation, to meet the needs of countries, and always starting there. What is it that countries need? What is it countries prioritize? And then accelerate impact in health by matching those innovations, those needs with innovation. So WHO's role in that innovation space, including digital innovation, is to be the facilitator, the convener, and in fact, the matchmaker between the health needs and priorities of countries and the mature and shovel-ready innovations, including digital solutions that can help accelerate impact and improve and save more lives globally. At present, WHO is working with countries to implement the global strategy on digital health, and we invite you to participate. We need an extended but united network for effective global coordination to support countries to adopt evidence-based and sustainable technologies that are aligned to their specific needs. As we move forward, we need everyone, governments, including governments, health sector entities, multilateral organizations, academia, and the private sector to come together to conceptualize, develop, finance, and implement a sustainable digital health ecosystem. Thank you once again for your commitment and support and for this invitation. Together, I think we have a very exciting opportunity to harness the power of technology for a healthier world. I thank you.
Thank you very much.
Dr. Red, did you still, sorry, go ahead.
No, I'll come back to the questions later on because I think others are going to be coming up with their statements.
Fine, thank you.
May I request Dr. Harpreet Singh from the Indian Council of Medical Research to present the perspectives of the ICMR, particularly from the point of view of applications in research.
Thank you, sir. Thank you, Ambassador Dr. Raul, Professor Reddy, Dr. Gill, and my colleagues from Switzerland and around the world, and the Embassy for giving this opportunity to present views on this very important and very pertinent topic in the light of COVID-19. The requirement for digital governance is much more felt in this current pandemic rather than the previous years. So just to give you a brief background, I'm heading the division of biomedical informatics at ICMR, and we are looking at rationalizing data systems across ICMR for various programs of ICMR as well as the ministry. So that gives the context. So my team has developed this COVID-19 testing and analytics system, and we are communicating with all the states and national stakeholders regarding testing results. So whatever I'm going to talk about is the experience that I'm having from working with all these systems. So if we look at digital health in a larger context, it is improving public health through the use of digital tools and technologies. So if I look at it, digital health can be looked from two broad perspectives: health services, care and delivery, and the second perspective is health research. So both contributes, both the perspectives, health services, care and delivery, and the health research contributes equally to the digital health. Since I am representing from the Department of Health Research and Indian Council of Medical Research, so my focus will be primarily on the digital health research component. However, the topics I'm going to touch upon, they will overlap in both the domains. So now coming back to the digital health, both from international and national perspective, governance of digital health requires three essential components. First one is innovation and development of technologies and tools. Second essential component is strengthening the communication between different digital health systems. So parts, bits and pieces, Mr. Lal Agarwal has also mentioned about the different systems are existing in silos, and probably all of you will agree with me. Third very important component, which I think Geneva and international agencies should look at, is stronger policies and legal frameworks which should facilitate both the first two components, that is innovation development and strengthening communication. So in my opinion, governance for digital health needs to be addressed at two levels. First, at the national level, the country level, and second, at the international level. So country level should focus on each of these three components, whereas the country should have governance for innovation development, communication, and policies and legal framework, whereas internationally, the agency should facilitate synergy between different countries by putting up relevant documentations, guidelines, and other related material. So now coming to another important aspect, since we are talking of digital health, data is a very important component of digital health. Hence, efforts are required for rationalizing and standardizing data systems, which is very much lacking. In addition to patient data, there is a strong requirement to focus on rationalizing device-to-device communications and device-to-human communication, which I think Dr. Amandeep Gill will agree with me, because this area we have not looked into very carefully, device-to-device communication. Another chapter in governance should be harmonization and synergy in metadata. All the time we are talking of data, but we are forgetting metadata is even more important than data. Without metadata, there is little sense in data. So both of these topics require separate discussion for improving the digital governance. Continuing with data, there is also need to focus on responsible data sharing and access. So I'm not saying that there should be open data sharing and access. There should be a responsible data sharing and access. And the tools and technologies, not just the data, but the tools and technologies as well, to avoid duplication of the efforts. Policies for data sharing and access exists in selected countries, and they also exist in selected institutions. However, there is a very strong requirement for unifying those policies because the policies are very diverse. So this kind of work is required, and very recently came across this challenge in the area of COVID, where COVID vaccine certificates and testing reports have to be made available internationally. So we are working on this challenge, and probably today we are going to launch APIs for the Ministry of Civil Aviation, which are going to. So these are kind of areas where we need a very strong international collaboration. From Geneva perspective, there is a strong need to look at the components of policies with a broader aim for facilitating synergy, harmonization, and integration of various data sources. So I would like to end upon by touching the theme of this discussion. Rather, I think I should touch upon that also, because Ayushman Bharat Digital Mission means most of speakers mentioned. So one of the very key and important component of this mission is the health ID, which in addition to providing benefits to various health schemes, it is also a very important component for health research, which is absolutely required. So in conclusion, I would like to touch upon this theme of discussing governance for digital health. There is a strong need for contribution from both national digital health programs and initiatives, as well as international coordination, as the disease knows no boundaries. I think with these words, I conclude my remarks. Thank you, sir.
Thank you very much, Dr. Singh. And now I would like to request Ms. Erika Plasala to present her views on behalf of the Agency for Developmental Cooperation.
Yes, hi. Good morning to you, and thanks a lot for this opportunity to speak about. To present our digital health portfolio. Well, at this point, as Ambassador Heckner just pointed out, everybody knows that Switzerland, and more precisely Geneva, Basel and Zug, are considered as hubs of innovation in digital health. And there is, Amandip also pointed out that there is a very strong ecosystem, especially in Geneva, of organizations to advance global health. And it is clear that Switzerland has the potential to become a leader in responsible digital health development and use, so in digital health governance, so to say. So as also mentioned by Ambassador Heckner, Switzerland and SDC have a strong strategic and policy framework on digitalization, including for the health sector, but beyond the health sector, I would say. So we do have the Switzerland's international cooperation strategy 21-24, the foreign policy strategy 2023, and the foreign health policy 1924, which define digitalization as key for advancing the Agenda 2030. So there is a very strong and robust policy framework. So what does now SDC? So first of all, in his approach to digital health, SDC first of all fosters a global health governance system that can better manage risks and seize opportunities offered by digitalization in health. And we heard from previous speakers that we do have this dilemma. There are opportunities, but at the same time, we know that there are a lot of risks which come actually with these opportunities, and that we have to really introduce measures which aim at mitigating those risks. The second principle in our approach is, as pointed out also by Dr. Agarwal, is really this intention, this aim to defragment the digital health space, to foster alignment and complementarity. That's a very important point, and it also explains, it also gives the SDC the opportunity to play a major role in this defragmentation, using Geneva as a hub, as Caroline Perrin pointed out. And then we promote a systemic approach, meaning that technologies and digital solutions are not seen as isolated tools, but as part of comprehensive packages to strengthen health systems and to reduce the digital divide between low and middle income countries and low income countries. So now, being more granular in what we do, so our strategic orientation and priorities are the following. There are basic three of them. The first one is really about policy and advocacy, and is about promoting good governance and bridging the digital divide, as I just said. So it is clear, and it was also pointed out by all panelists, the emergence of a highly lucrative health data economy, and at the same time, weak or inappropriate governance models pose serious risks to patient data security and privacy and protection. So, and SDC advocates for bridging the digital divide and data divide in order to leave no one behind, and to build robust regulations and frameworks for the responsible use of digital health solution. And to this end, we were very much involved in developing and negotiating key resolutions and strategies around digital health, such as the new WHO strategy for digital health Louise just presented. So in addition, again, at the framework level, at the regulatory and policy level, we support the Lancet and Financial Times Commission, the Governing Health Futures Commission, and maybe I'm sure all of you are familiar with the Commission, which tries to examine integrative policies for digital health and AI to identify which ones actually have the largest potential to improve health and maximize health equity in resource-poor settings, while at the same time ensuring human rights. So that's the first priority. It's really the governance level and the policy and regulatory framework level. Then we promote coordination and alignment, again with the aim to defragment the digital health space. Caroline mentioned that we have a very fragmented landscape. And to address this fragmentation, actually, we have set up the Geneva Hub for Digital Health in collaboration with the University of Geneva, Geneva University Hospital, and the WHO. Well, the hub aims to federate and connect Swiss digital health, international health expertise, knowledge, and stakeholders in low and middle income countries. And we hope that it will really facilitate the matchmaking between needs and solutions to guide rational investments in sustainable digital health projects in low and middle income countries. And now the last priority, the last cluster of priorities is about really scaling up digital solutions for health system strengthening and pandemic preparedness. We have introduced a lot of solutions within our project, but these have now to be put together in the same understanding, the same ground of understanding around what it means. And we really have now to support the integration, the interoperability, and defragmentation of those solutions. For example, just a couple of solutions we have introduced, which are now in a scaling up phase. So we do have, for example, the Open Insurance Management Information System, which is an open source software that provides a comprehensive system linking patient, provider, and payer data. And as it is open source, of course, anyone can copy, modify, distribute the source code, which will be managed and continuously improved by the open source software community. And this tool has been successfully introduced in Nepal, Cameroon, Kivu, Chad, and Gambia. But we are now trying really to scale it up in other regions and to make it really compatible and fully integrated in the national systems. And now, another example is the support to integrated surveillance system for zoonotic diseases, such as COVID-19, at the interface, of course, of human and animal health and the environment. And in this regard, we support the Zodiac system, Zodiac solution developed by the International Atomic Energy Agency. So you see that I think our comparative advantage is really, as a state, as a government agency, to really to move forward with at these three levels. So the governance level, policy level, because there is a vacuum to be filled there. There is, we call it a Wild West, but there is really a need to regulate that space. And then we do have the defragmentation level. So what we can do in Switzerland using the comparative advantage of Geneva, Zug, and Basel to really to foster a kind of integrated approach and bringing together, stakeholders in the global south and in Switzerland. And then the third level is really about, at our level, really trying to defragment, to think about how we can better leverage the potential of the digital health solutions we introduced in our own initiatives at the global, but at the regional and at the country level, in order really to move forward with health system strengthening for advancing universal health coverage. Thanks a lot.
Thank you very much. Now, after all the speakers have given their perspectives from their organizational viewpoint and the activities they are leading, we have some opportunity for questions and interactive discussion. But let me start with Ambassador Amandeep Gill. How can we ensure that processes are inclusive and solutions are sustainable? I mean, digital health is advancing rapidly, but will there be digital equity, or will there be an increase in the digital divide within countries and across countries?
So the jury is still out, Professor Reddy, on that question. We have these existing divides on connectivity, on access, meaningful access, not just having a signal, but meaningful access. We also have this growing divide on data and advanced AI. So unless we take urgent action, these divides are likely to grow. So leveling the knowledge-making playing field to me is one of the most urgent priorities. So it's not about giving tools and giving access. That's important. Connectivity is important. But capacity building to be able to use digital technologies, capacity building in the governance domain so that you can create the frameworks for building up the ecosystem that Lava Agarwal and Erica and others have described. So that is most urgent.
Thank you. Now may I request the WHO representative, Ms. Agasnab. How will WHO link digital health and innovations to specific country needs? Is it going to be trying to customize through the country offices or through the regional offices? And how will it do so through the national agencies?
Thank you so much, Dr. Reddy, for this excellent question. So what WHO has been doing and is doing with its innovation work, and first of all, figuring out what is the best value add and the best role that WHO can play in this role, also recognizing the vibrant ecosystem in Geneva and beyond. There's so much happening in digital health and innovation. So we have to find a way that we can add value and not become a duplication of what's already happening and just more noise, more Wild West, as to use the words of Ms. Barcelo. So we've set up what we call the WHO Innovation Scaling Framework, and it's in essence a new way of working within WHO and with partners. It is, the way we depict it is actually as a triangle where you have demand / country needs and priorities on the top, and that's where we will always start the conversation. And I think that's part of the trick, is always letting our efforts in digital health and innovation be geared towards what is it that country needs, what are the priorities, and being very inclusive and sustainable in that analysis. So we use our own data on health-related sustainable development goals and looking at where are the pain points, how does the heat map look, and where are we really lagging behind? And universal health coverage is one of the really tough ones. And also, so we're focusing right now on primary healthcare innovations, and now I'm talking about the WHO Innovation Hub. But a lot of that work is about digital technologies, but not in isolation. Digital technology solutions that are often, when they're most effective and sustainable, they're embedded within a government program for primary health care or an approach to mental health, or it's really within a wider setting of, could also be primary health care or community health workers that go out to the last mile and reach people where they are using digital tools to get there. And we want to help get those tools to countries where they need them and to address those pain points where we are not making enough progress, where we can save more people, improve more lives. So that triangle starts with that need and those priorities. And then we link and we matchmake with the supply of mature solutions. So WHO is not an incubator. There are so many incubators out there that are doing an amazing job, innovation funders and innovation aggregators. So we want to work with them. So we are forming partnerships with something called the International Development Innovation Alliance, but also the Islamic Development Bank and other organizations that do this for a living. And I know that there are many here on the call as well playing that role. So aggregating in innovations and managing that Wild West of the retail space of innovation, so to speak. So WHO needs help on that, and we are therefore forming those partnerships. So when we understand the needs, we go to our partners and say, for instance, now we need innovations in medical oxygen delivery. That happened a year ago, and we started testing this way of working. And then we went with that. We heard that need from countries through our regional focal points, went to our innovator aggregators and expressed that need. They came to us with 6 very mature medical oxygen innovations. We then went to the third part of the triangle, which is assessment. There had already been a lot of assessment going into those innovations by the innovation funders because they incubate and assess and mature innovations. But we also applied WHO's technical expertise, which is another area where we believe WHO can play a role. So we ran it through our expert panels, and they found 5 of the 6 innovations acceptable. With that, we went back to our regions and countries, who then brought it into conversations with ministries of health. And long story short, that led to Somalia, with the leadership of WHO's representative there, installing a first pilot of solar-powered oxygen concentrators in a children's hospital. And this is already saving lives and improving lives for children and beyond. So it's just to say it's demand, supply, assessment. That's really how we work. And that's, in a way, our governance model for managing the innovations in digital health and other innovations. And we're very keen to work with others and help leverage WHO's presence in 150 countries and all our member states, and our dialogue with ministries of health to bring innovation into those conversations and really focusing on the most mature and tested solutions, and then bring them in, because this is where we can accelerate impact and save more lives.
Thank you very much. Dr. Singh, it's very clear that whether it is for research or particularly in advancing health system programs through digital health, we have a number of players who are involved. And if we have to really enter into that large big data universe where we have a variety of healthcare players, including service providers, pharma majors, patients, insurance providers, with all these multiple agencies, how do we actually create a functioning digital health governance framework at the national level?
Thank you, sir. That's a very interesting question. And in fact, if we have multiple players, one of the most common thing that comes in mind is the federated architecture. So the views I'm going to present here are my own views. So federated architecture is it's a very important and very useful, but it has its own limitations, the federated architecture. One of the major limitations with federated architecture, you can imagine there are 50 hospitals who have their own hospital information management systems, and then you have another set of players, universities and medical colleges who have their own systems. Asking them to put up all the data on a client-server architecture, on a federated architecture, on a very unified single system is a little bit challenging. So one component of putting all those players on a single platform is first thing is there has to be mechanisms, there has to be technologies without disrupting their existing system. They should be able to contribute on a single platform. This is one way of looking at it. And second is the incentivization. So if they are going to put up information on a single platform, what incentives they are going to get out of it? So if we can address those two challenges, I think it is a very easy, doable job to integrate and put all those stakeholders on one platform. And in fact, it is very much required also. So there are technologies which are in place and there are incentives which we can put up. So this is something which is important and doable and should be done.
Thank you. You're pointing us in the direction of a digital commons, which will not permit digital anarchy. That's excellent. Now, that brings us to the question of federal structures. In India, we have multiple states and union territories. We know that Switzerland too has multiple different cantons and has a very strong federal structure. How is actually digital health harmonized across the federal structure in Switzerland, and what do you feel are the messages that you can give to other countries with a strong federal structure? May I request Dr. Caroline Perrin, please, to comment on that?
Yes, so in exactly in Switzerland, health is not regulated at the federal level, so it's really the cantonal power, so it can be very different from one canton to the other. There are different efforts that are on the way in terms of facilitating digital health, the digital health ecosystem in Switzerland. There's eHealth Swiss, which is a coordinating mechanism which really aims at creating an ecosystem that will allow exchange of electronic medical records, for example, between the different cantons and so on. Then we also have something which I think could be of interest to the audience, the Swiss Personalized Health Network, which aims at bringing together all the data from the hospitals and medical records for research and finding a way how we can share these data for research. And it's a quite ambitious project, but it's well along the way. And I think if you're interested in more detailed information, I invite you also to look on the website.
Thank you. Well, another question that comes up is that multiple groups and countries are working on digital health. Can a government mechanism be set up to avoid duplication of efforts, or even through an international agency, can we set up a mechanism to avoid duplication of efforts? But will that urge for uniformity curb innovation? So how do we balance between innovation and economy of effort? May I invite comments from Ms. Erika Placella?
Thank you for the question. It's a very interesting one. I do not think that uniformization or defragmentation could lead to the lack of innovation. I do think that there is a lot of innovation and that maybe we went too far in duplicating, in not speaking to each other. And I think it's a government, at least at the Swiss level and in the countries where international cooperation is working in health, at least we do have that kind of leverage, of opportunity to defragment and to bring together the different stakeholders. And the duplication, the most important reason for duplication and fragmentation comes from the fact that it's not, I mean, a lot of these solutions are not needs-based. So they are not, there is no, that's why I was talking about the digital health hub in Geneva being a kind of connector between connecting the needs, I mean, the demand with the offer in Switzerland. It's not the other way around. So we should not have beautiful, tools in Switzerland developed in the beautiful Geneva and the EPFZ, EPFL, and then we try to find a market in a low and middle income country. It should be the contrary. And that's really our role in this fragmentation. It's a key role we do have. We have to think about what are the needs in low and middle income countries. And then we can connect with solutions here in Switzerland on the international level. That's really our role and our duty in this effort to defragment. So first of all, stick to the needs. Don't reinvent the wheel, and try to stick to demands. Tailored demands, evidence-based demands, which can be connected with solutions here in Switzerland, and not the other way around. That's a very important point, and that's really our duty. And I really hope that other donors will join. Around the join the hub with the same intention and the same mindset, not to add another layer. But to move layers away and to stick to the needs and to play this connector role. I'm talking about Switzerland, but I know that Sweden has a very good digital strategy. They also have a lot of comparative advantage. So they could play the same role, in trying to defragment, trying to connect the needs with the demand, the demands with the offer in Switzerland or in Norway or anywhere else. So that's how I think we do have a very important role beyond just providing funds to set up a digital health hub in Geneva or in any other country.
So, thank you, because it's a clear call that we must try and get into just like vaccine nationalism, into digital nationalism.
Exactly. That's a very interesting concept.
And just
digital nationalism.
And just like environment, we must think globally, but act locally, have local innovations, but link up global systems. So I think that's the way to go. So now, Amandeep, that brings us to your area. In terms of your efforts to link up some of these global actors, both at the national level and at the global level, through IDARE. And IDARE is a wonderful acronym because you're daring to go into very new spaces and creating new value. What are the prerequisites for actors, including countries, to take part in the digital health governance discussions? And how can we help or support these actors to do so? How do we actually, we're not talking about empowering them, but how to assist and enable them?
That's a great question. And on IDARE, when the Singapore representative spoke, he said, IDARE, we dare. So it's more of a collective daring, I would say. But I think enabling participation in governance discussions and also shaping governance, that was a key theme for us when the UN Secretary General had his panel in 2018 and the report came out in June 2019. And we listed several measures that are important. I think simply the awareness, the literacy around data, around AI, what's hype, what is real, that's very important. The other aspect is for the international organization that are the aggregators of governance thinking to be more inclusive in their approach. I mean, there is the kind of current inclusiveness approach, but then there are barriers to, let's say, the participation of the private sector in some of those discussions, younger researchers, entrepreneurs, and opening up those governance discussions to these other players who know more about technology than people sitting in the secretariats of those organizations. So no criticism implied. This is something that the SG himself acknowledged. So I think that's very important. And then transparency with regard to the outcomes. Looping the governance to the practice of innovation on the ground. So it has to be practiced informed governance, not top-down governance. So I think that is key to engaging more countries, especially those who are going to, in digital, it's very hard to force people into a single tool, into a single ideology. And for good reason. So people are just going to do their own thing if we are not thoughtful about governance.
Thank you very much. This has been a very stimulating session with excellent presentations, providing different but complementary perspectives and giving succinct accounts of experiences from respective organizations, and a very stimulating discussion to follow. And I thank the Swiss Embassy for arranging this. I'm sure digital health has a great future globally and in India, and I'm sure there'll be many more conversations to follow. I'm handing back to Indraneel.
Thank you all for participating and listening in actively. I know we are way beyond time, So the last word to Ambassador Heckner. Ambassador, over to you.
Thank you, Indranil. I think Professor Reddy made the point. There is a huge potential when it comes to digital health. And if we have a look at what people want, there are three things. They want to have healthcare, they want to have an education, they want to have a job. So definitely this potential is there, and I converge with what Professor Reddy said. This will be not the last conversation. And as we have seen by the presentation of the Joint Secretary of Health and Family Welfare, you can deliver healthcare digitally to hundreds of millions of people in a very short time. And I think this is also something that we always have to remember. You can get things done. And with that, I would like to conclude and very much thank Professor Reddy for ably organizing and conducting today's panel. And I would like to thank the panelists for their time that they made for us and their insights. And with that, I wish you all a very good morning and a very good afternoon, depending on where you are in India or in Switzerland. Thank you all. Wishing you a very good day.